So, good morning, ma'am. Good morning, everyone. So, for today's video, I'm gonna perform na the CBG or the capillary blood glucose. So, it is the most frequently recommended for people with diabetes. Additionally, people use capillary blood glucose monitoring to regularly test the glucose level in the blood. For the first procedure is introduce yourself to the patient for comfortable and at ease. So, good morning, sir. I'm Diana Rose M. Reyes, and I'm your nurse for today. How are you, sir? Okay. Okay. Thank you, sir. So, for the next procedure is verify doctor's order for frequency and glucose testing. This is to prevent error and for the patient's safety. The next procedure is gather necessary equipment to save time and effort, including the improvised blood glucose monitor or the glucometer. Next is the test strip for blood glucose for glucose monitoring. Pakita mo ba? Next is non-sterile gloves. Next is the lancet and the autoclip or the lancet injector, the cotton balls, and or the alcohol wipes, and then or the alcohol, and then lastly is the sharp and biohazard disposable unit. So next procedure is verify the identity of the patient by checking the identification bracelet or by addressing the name. So what's you're a Devin, sir, you're Devin Joe?
Yes.
Okay, thank you, sir. Next procedure is provide client's privacy for the clients not expose her condition or her identity or her or him identity by, for example, by closing the window or the curtains, because that's the patient's right. And next is perform hand hygiene to prevent spread of microorganism for the safety of the nurse and for the patient. So for the next procedure is explain to the client what is the procedure to be done, and inquire the patient the finger preference and use of lancet injection. It is to for the client to be aware and for comfortable of the procedure and to have a easy flow of the procedure. Sir, ang gagawin po natin ngayon ay ang tinatawag pong CBG or the capillary blood glucose. Wherein, sir, dito po is mamamonitor or yung mamemeasure po natin yung level of glucose niyo po, sir. So, sir, ito po is para po mapigilan or ang mga maaaring maging komplikasyon, mapigilan po yung hypoglycemia or hyperglycemia, sir. So, asan po yung mas prefer mo, sir, na so, yan po. So, ito po yung lancet injector. So, ito po is ipiprick po natin mamaya dyan sa kamay mo na mas prefer mo, sir, para po makuhanan ka po ng dugo, sir. Sir, naintindihan mo pa yung sinasabi ko, sir?
Opo.
Okay, thank you po, sir. For the next procedure is calibrate glucose machine to ensure that the result obtained are accurate. So, imaginein po natin na ito is yung improvised or ito yung totoong glucose machine. So, dapat ang makikita natin dito is may screen siya, may open, then dalawa ito. Yung isa is para makon yung time. And then, dito yung test strip slot, dito natin ipapasok mamaya yung test strip. So, first is ito-turn natin yung machine on. I-open muna natin. And then, compare number code of machine with the number of the bottle strip. Dapat same sila ng code. And then, dito naman sa bottle of strip, the number dapat tatanda natin na dapat same sila. Next is prepare machine for operation. Consult user's manual for step and readiness indicator. Then validate natin yung machine accuracy daily or per laboratory policy with sample low and high glucose solutions. So here is dapat i-sure natin na gumagana yung machine and then this is para ma-prepare or para ma-ready na natin. And then remove chemical strip from container and place into the glucose testing machine. So next naman is to prevent delay once the sample is obtained. Ikakan na natin chemical strip from container and place it in the glucose testing machine. And then next is kunyari ganyan, inlagay na natin siya dyan. Ganyan kasi makikita natin kapag glucose machine na talaga siya. And then load lancet in injector if it is used and set trigger. Prefer injector for lance puncture. For example, ito yung natin, improvise natin. Then lalagay na natin dito yung lancet and then i-shoot natin ganyan para ready na siya. This procedure is done glove to prevent exposure to blood and for the safety of the nurse and for the patient. So, ang gagamitin natin is non-sterile. Next procedure is hold chosen finger down and squeeze gently. So, dito is tatandaan na natin na dapat yung malambot na finger yung kanin natin. Kasi mas madaling kuhanan ng tugo. Kwento mo ba? Para mabilis makuhanan ng dugo. So, here is squeeze gently from lower digit to fingertip or wrap finger in a warm, wet cloth for 30 seconds or longer. It is to promote blood flow in area for ease in specimen collection and then mas marami dito makukuhang blood kapag dito sa gilid mo siya. Ganun, kasi mas maraming capillary. Then, next is wipe puncture site with alcohol pad. So, ikakan na lang natin. Iwa-wipe natin. Then, patutuyan na lang natin. And then, next is to remove dirt and skin us and decrease microorganism. Then, place injector against side of that finger where there are fewer nerve endings and release trigger or stick side into the fingertip with lancet or needle using a darting motion. Obtain a large drop of blood with minimal pain. So here, naka-ready na yung patient. So next is i-hold natin yung chemical strip under puncture site and squeeze gently until drop of blood is large enough to drop on the strip and cover indicator squares. If using arm lancet device, hold strip close to blood drop after appropriate amount of blood. So it is to ensure that indicator squares are covered with blood, prevents an uneven exposure of indicator which would leading to inaccurate reading. So here there's a additional of Ma'am Charabel earlier that yung unang blood is hindi natin siya i-consider, then yung pangalawang blood yung i-consider natin para mas marami siya and mas accurate. So sa iba naman, if necessary, push timer button. Nandito yung timer button. As soon as blood has covered indicator squares or area on test strip. Most machines automatically begin timing and require no action to start timing once blood makes constant with strip. So, activates timing mechanism if necessary. So, hindi natin mapapakita yun kasi nga wala tayong capillary glucose or yung glucose machine. Hindi natin mapapakita yung timing, yung screen, and yung strip. So, parang sa akin is parang malaking kawalan yun kasi hindi ko masyadong gamay or na-practice. Pero, I will do all my best to ma-retain sa utak ko yung procedure para in case na may face-to-face or nasa field na as a nurses soon, as a frontliner soon is ma-retain ko pa rin siya at ma-apply ko siya ng accurate. For the promotion of health, to prevent illness, and to alleviate suffering. Apply na natin yung pressure on puncture site until bleeding is stopped. Or have the client to do so. Pwede mo siyang hawakan, sir, para mag-stop yung blood. And place lancet sharp biohazard disposal unit. So, here is the rationale is to reduce risk of needle streak and injury. So, for example, ito yung biohazard disposal unit is itatapon natin siya. When timer indicates that appropriate number of seconds has passed, read the glucose value to ensure accurate reading. And then next is discard soiled materials and gloves in proper container to reduce risk of infection transmission. For the nurse safety and for the patient safety. So, ilalagay natin siya sa container. Next, procedure is i-record na natin yung result of glucose level. Wait lang. Procedure is i-record natin yung result in the glucose flow sheet and administer insulin if indicated. So, it is to maintain record of glucose level. So, take note that it depends to the institution pattern. And then, next is, lastly, is position client appropriately with call light within reach to promote comfort and communication. So, are you comfortable, sir?
Yes.
Wala naman po kayong nararamdaman? So that is for today, sir. Thank you for your time and effort. So, God bless you, sir.